These Congolese children are re-entering the world after 5 days of isolation. It's the first year of their lives, and they're at the center of a deadly Ebola outbreak. The babies are all orphans who were brought to this hospital after showing symptoms of the virus. They've just tested negative and are being taken to a temporary home. But at least 2 other babies from the same orphanage have died. What happened to them has been a worst-case scenario for health officials trying to stop Ebola from spreading to young children. The alarms went off in late May here at Saint Nicholas Children's Home after the arrival of a newborn girl, Patience, who quickly developed a fever. We were given a tour of the orphanage where nearly 70 children plus their caretakers live.
Une fille tout bébé, tout petit là. La fête était bien, à bonne santé. L'enfant sourit aussi un peu là parce que même le bébé sourit toujours.
A pediatrician tracked baby Patience's mother's case and learned that she had Ebola when she died. Days later, Patience died too. She was 9 days old. This was one of the last photos taken of her while she was still alive.
C'était ma toute première fois de voir un nouveau-né faire cette maladie et partir comme ça. Et c'est vraiment pas du tout bon.
Mais peut-être les familles savaient, mais ils ne nous ont pas dit. Si jamais ils nous étaient informés que la maman était morte de cette maladie, nous n'allions pas accepter la fin de cette orpheline.
It's unclear whether the family knew she could be infected. The relative who brought her to Saint Nicholas declined to talk to us when we reached him by phone. By the time anyone at the orphanage understood the danger, some of the staff had already held and cared for Patience.
On ne peut pas prendre soin d'un enfant sans le toucher. Ce n'est pas possible parce que les enfants, d'abord, ils sont des innocents. Nos enfants manquent d'abord normal l'affection parce qu'ils sont à l'orpheline.
Soon, more children were showing symptoms of the virus. Bonjour. When we visited the Ebola treatment ward, this 10-month-old seemed to be getting better. Baby Elise was being cared for by Sister Cécile Nube, one of 3 staff members at the orphanage who also tested positive.
Quand on était venu avec le bébé à côté de moi, elle était agitée. Un jour, elle n'a pas fermé les yeux. Ça jouait encore sur ma psychologie davantage.
Even while sick herself, Sister Nube stayed by Elise's side, feeding her, giving her medicine, and watching over her.
Je ne peux pas l'abandonner comme ça. Je dois soigner la femme jusqu'au bout.
Elise died 24 hours after we met her. A reminder of how quickly the disease can turn, especially for babies. Now Saint Nicholas is under quarantine. Every day, contact tracers visit the orphanage, checking the children and their caretakers for fevers.
Some of them today are presenting a little bit higher temperature, but they're okay at the moment.
The concern is that one infection here could quickly become many.
It could have been a recipe of disaster. It's a very classic situation where Ebola can very fastly devastate the community. They are playing together and they are spending the whole day together. So it's like spreading from one person to the next, and for zero time you'll see the entire community being infected.
For now, the orphanage remains under watch. It's still a refuge for children who need shelter and care, even as every new symptom raises the fear that the virus could still be spreading.